my name is Lacey Schooley, and today I'll be demonstrating how to perform a bed bath and change an occupied bed. So before entering the patient's room, I'm going to check the chart to make sure that they can receive a bed bath, place a bath in progress sign on the door, and then enter the patient's room, perform hand hygiene. Hi, my name is Lacey. I'm going to be your nurse today. We're going to do a bed bath. Is that okay? Perfect. So I'm going to start by putting on gloves. And then start by removing the comforter, folding it inside itself, collecting any contaminants, making sure not to touch my scrubs. Place this in the linen bag. Okay. Then I am going to place the bath blanket on the patient. And then I'll have an assisting nurse grab the top of the bath blanket while I pull the sheet out. Making sure to roll it into itself. Place it in the linen bag. And then take off the patient's gown. So this bed doesn't have side rails, but normally I put the side rail up before I go around to the other side. Again, put the side rail up. And then place this in the linen bag as well. Now that I have done touching the soiled linen and gown, I'm going to replace my gloves and put new clean gloves on. So to start the bed bath, I am going to start by filling my basin 2/3 full with water. And then before using it, test the temperature on my wrist, making sure it's not too hot for the patient. Place a towel under the patient's head. Okay. So we're gonna get the towel wet, create a mitt, not using soap to clean the face. So I'm gonna start with the side farthest from me, going from the inner cantus to the outer cantus. Same on the other eye, using a different surface of the rag. And then forehead to chin, forehead to chin, making sure to rotate my rag. Okay, and then pat the face dry. Okay, now I am going to apply soap to my rag, create a mitt, and clean the neck, going from behind the ear downwards. Same on the other side, making sure to use different sides of my rag. Dry the neck. Okay. Take the towel out from under the patient's head, and the next step is to clean the arm. So in normal circumstances, I'd start with the arm farthest from me, but for the purposes of the video, I'm just going to clean the arm nearest to me. So I'm going to place the towel under the patient's arm. Only exposing what's needed. Rinse the rag. Make sure to put soap on it. Create my mitt, and then clean the arm from distal to proximal. making sure to support the arm and rotate the rag with each swipe. And then clean the axillary area and also apply deodorant if the patient wishes. And have the arm dry. Okay. Cover the arm back up. Remove the towel. Okay. Now I will be cleaning the chest. So I'm going to place the towel over the chest and pull down the bath blanket, making sure that the patient is still covered. Again, rinse my rag, add some soap, create my bath mitt, and clean the chest. If this were a female patient, I would make sure to lift up the breast and clean underneath and assess the tissue for any breakdown or redness, and also clean outer and inner. So I'm going to dry the patient's chest, rinse my rag, apply more soap, and move on to the abdominal area. So again, only exposing the area that is needed to clean, using a different portion of my rag with each swipe, and dry. Okay. Then replace the bath blanket over the patient's chest. The next step is to clean the leg. So I'm only going to clean the inner leg for the purpose of the video, but I would start with the outer leg first. So I'm going to expose the leg and support it while I place the towel underneath. Okay. Rinse my rag, apply soap, and create a mitt. Cleaning from distal to proximal, or the ankle to the hip, making sure with each stride I use a different portion of my rag. Okay. And then dry the patient's leg. Okay, and then I'm going to cover the leg back up with the bath blanket, but leave the towel underneath because I'm going to clean the foot next. So I'm going to get new water, rinse out the basin, test it to make sure it's not too hot, add some soap to it, and I checked the patient's charts. There's no diabetes, so I can go ahead and clean the leg. So I'm going to assist the patient in bending at the knee and place the foot into the basin and make sure to scrub the patient's foot in between the toes especially. Okay. When that is all done, I'm going to get new water, again testing it. This is to rinse the patient's foot off, making sure I just get all the soap off in between the toes, the bottom of the foot. Okay. Place the patient's foot, and then I'd get new water here as well. I'm going to dry foot, making sure to really get in between the toes. Okay. So normally I would clean the outer foot, change the water before I started the new foot. So now that that is done, I am going to change my gloves after cleaning the foot, and I'm going to have my assisting nurse help me flip the patient onto its side so I can clean the back and rectal area. Okay, so we're going to turn you on your side so we can clean your back and rectal area, okay? Okay. So I'm going to place the towel underneath my patient's back. Okay. So my water has been changed. I'm going to test the temperature to make sure it is not too hot. Get my rag, apply soap. Okay, create my mitt. clean the bottom up. Making sure with each stride I'm using a different portion of the rag. Okay. Going to dry the back. Okay, now for the rectal area, I would love to see if there's any fecal matter, and since there is not, I don't have to clean with the tissue first. I'm just going to start by cleaning with the rag. So I'm going to apply soap, create my mitt, and again, with each stride, making sure I'm using a different portion of the rag. Okay, I'd also assess between the skin between the buttocks, making sure that there's no breakdown or redness. So, dry this area. Okay, remove the towel and assist the patient on the back again. Okay, now I'm going to discard this towel and this rag as well. Going to get new water, rinse it, test it on my wrist, and now I'm going to perform narrow care. So to begin this, I'm going to put the bath blanket into a diamond shape, which is going to provide the patient with the most coverage. Making sure it's not touching the floor. Okay. So to start this, I'm going to bend the patient's leg at the knee and use the outer diamond and wrap it around the leg, which provides coverage. And again on this side, bend at the knee, use this outer corner and wrap it around the patient's leg. Okay, so with this allows me to fold up the bottom diamond and expose the area that I need to clean. So I've tested the water, got new water, so I'm gonna get a new rag, get it wet, add some soap, create my mitt, fold up this bottom portion of the rag. So I'm gonna start by cleaning the outer portions, making sure to use a different portion of my rag and clean down the shaft of the penis. And then if the patient was uncircumcised, I would pull back on the foreskin and clean in between it, and then make sure to put it back in place. That way there was no cutting off of circulation. Okay, so now pull this back down, unwrap the patient's leg, let him lay flat and relax. Get on this side. Okay. The last thing I need to do for the bed bath is perform oral care. So, to do that, I'm going to use a clothing protector or towel. Place it on the patient. Okay. So in a cup, I'm going to mix mouthwash and a water solution. I need a tongue blade and swabs to do this. So this particular patient, also a pan. This particular patient is in a coma, so I'm going to turn the patient's head to the side. Okay. Using a tongue blade, check the gag reflex, which is there. So I'm going to place the pan under the patient's chin and use the tongue blade and insert it into the side of the patient's mouth. Okay, and then using the swab, dip it in my solution, clean the side of the mouth, get a new swab again, clean the half tongue area, new swab to clean the top. Okay, and then take out the tongue blade. From this side, get a new tongue blade to insert into the other side of the mouth. Okay, with a new swab, clean this half of the mouth. new swab to clean the bottom half, and then one last time, new swab to clean this half of the mouth on the top. Okay, so that is done. I will remove the tongue blade, and then if there's excessive moisture inside the mouth, you can get a third tongue blade to dry it out if needed. Okay. So now that that is done, I place the patient back in a comfortable position. Dispose of these materials and throw this in the linen. So the next step is to perform a bed change. So before I do that, I am going to place a gown on my patient. Doing this with the least amount of exposure. Okay, and again, I would place the bed rails up, but we don't have bed rails on this particular bed. Okay, so now we can continue with the bed change. So, going to have my assisting nurse help me flip the patient onto the side. Okay. Okay, so I'm going to start by rolling the old linens into themselves up to the patient. Okay, and then before I grab the new linens, I'm going to change my gloves. Now that my gloves are changed, and then if the old sheets were soiled, I could get another protector to put between them. That way they weren't touching. And place a draw sheet on the bed. Again, fold that up. Okay. So now we are going to flip the patient onto this side of the bed so I can finish the bed change. So I'm just going to let the patient know, okay, we're going to turn you over. You are going to roll over a bump of sheets. Okay. So then we will switch sides. And roll this patient onto the side. Okay, and finish removing the old sheets, rolling them into one another, or into themselves, I guess. Change my gloves before I touch the new sheets. sure he's centered in the bed, that way he's comfortable. Okay. Next thing, we're going to put the top sheet on. And with the help of my assisting nurse once again, I'm going to have her hold the top of the top sheet while I pull out the back blanket. Rolling it into itself, placing it in the limb bag. Thank you. And then placing the top comforter on. I'm going to fold down the top so it doesn't irritate the patient's neck. And fold the bottom. And then grab the side, tuck the corner. And loosening it at the bottom, making sure that there's no constriction at the feet. And the last thing is the pillowcase. Throw that in the linen bag. And your pillowcase. Flip the pillowcase inside out the way I'm putting it on. Touch it to my body. Flatten it out for the patient. Patient's head. Okay, the last thing I need to do is clean the patient's dentures. So I'm going to use a new rag and line the bottom of the sink so that way if the dentures fall for whatever reason, they don't get damaged. So I'm going to apply a little bit of toothpaste to the toothbrush and clean dentures, making sure to get all surfaces. The gums, the teeth, the top. And then when I'm done scrubbing, I'm going to rinse it in cool water. Okay, and place it back in. When placing it, I'm going to use the patient's preference if they want it soaked in cool water, if they would like a tablet when it's soaking, or if they don't want it soaking at all. Then again with the top set, make sure to clean the top, the dentures, the teeth, and then the palate of the mouth as well. Okay, again, rinse it in cool water, place it in the case. So now that I'm done, I'll remove my gloves, perform hand hygiene once again. If the patient were conscious, ask them if they need anything else, exit the room,